Hello, good morning. Myself, Dr. Ravina Kalyan, Faculty of Physiotherapy Department in RPIIT, Technical and Medical Campus, Karnal. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So, in this presentation, we'll talk about the hip joint ligament. So, first ligament is the iliofemoral ligament. So, iliofemoral ligament is anterior to the hip joint and is triangularly shaped. Its apex is attached to the ilium between the anterior inferior iliac spine and the margin of the acetabulum, and its base is attached along the intertrochanteric line of the femur. The parts of the ligament attached above and below the intertrochanteric line are thicker than that attached to the central part of the line. This results in the ligament having a Y appearance. Next is this is a diagram of iliofemoral ligament. So it starts from the anterior inferior iliac spine and iliopubic eminence to the pubofemoral ligament. Next is a pubofemoral ligament. Is a anterior inferior to the hip joint. It is also triangular in shape with its base attached medial to the iliopubic eminence, adjacent bone and obturator membrane. Laterally, it blends with the fibrous membrane and with the deep surface of the iliofemoral ligament. So this figure shows the pubofemoral ligament. Next is the ischiofemoral ligament. So it reinforces the posterior aspect of the fibrous membrane and it attached medially to the ischium, just posterior inferiorly to the acetabulum and lateral to the greater trochanter, deep to the iliofemoral ligament. So this figure shows the ischiofemoral ligament. Next ligament is the ligament of the head of femur. So the ligament of the head of femur is a flat band of delicate connective tissue that attaches to one end of the fovea on the head of the femur and at the other end of the acetabular fossa. Transverse acetabular ligament and margins of the acetabular notch, and it carries a small branch of the obturator artery which contributes to the blood supply of the head and femur. Next, this figure shows the ligament of the head of femur. So the fiber of all three ligaments are oriented in the spiral fashion around the hip joint so that they become taut when the joint is extended. This stabilizes the joint and reduces the amount of muscle energy required to maintain a standing position. Thank you.